Hello everyone. My name is Sam and I will be presenting to you our Foundations of Integrative Care presentation. This was put together by my group and myself, and I hope you guys are excited to learn some new things about a couple healthcare professions that maybe you didn't know about before. So thank you for joining us today, and let's begin. Today we will have four different health professionals that we will be presenting to you about. Two of them are practitioners, one from traditional Chinese medicine and another one from Ayurveda. Also, we have two allied health professionals that we researched. One is a medical assistant and the other one a music therapist. The first health profession that we'll be looking at is traditional Chinese medicine. Their paradigm of healing is the mind and body. So they utilize practices such as acupuncture or Tai Chi to help improve quality of life and restore the balance between humanity and nature. For education in this field, one can get a master's degree in acupuncture, a master's degree in Chinese medicine, or even your doctorate degree in Chinese medicine. And all of these are actually offered at Northwestern. The environment that you can go into after getting your degree, one could be self-employed, work at a community position, integrative care, or even a specialty practice. It's very common that you might work in an integrative setting, possibly a hospital or even an outpatient clinic where you're working in a team with other health professionals. The scope of practice for traditional Chinese medicine has a wide array of things. Acupuncture, acupressure, moxibustion, which involves cupping or burning of dried mugwort, also herbology, nutritional counseling, tuina, which is a type of massaging, and they also do exercise regimens, which involves Qigong or Tai Chi. Income for traditional Chinese medicine, acupuncturists make roughly around $67,700 on average, with traditional Chinese medicine making $73,419 on average, but your master's versus doctorate does change that. Areas of focus is honestly everyone. There's a lot of people there listed, but as you can see, everyone can go to traditional Chinese medicine, and that's why the accessibility is for everyone as well.
Right. All right. So I just wanted to thank you for coming today to this interview, even though it's virtual. Like I said, my name is Maddie. I just have a couple questions here for you. I am a first-year student at Northwestern Health Sciences. I'm going for radiation therapy.
Cool.
Yeah, this project is to highlight healthcare professionals like yourself.
Nice.
First question is, will you just give me a brief description of what you do?
So primarily I do acupuncture and Chinese herbal medicine. And I treat a wide range of things. My specialty is dermatology, and that's using primarily Chinese herbal formulas. I do some cupping, and I use electrostim a lot on the needles.
Okay. What is that?
So it's similar to like the pads, people use the muscle stimulator pads, but this is little alligator clips that are placed on each needle, and you put a little bit of electricity through it.
That's really cool.
Yeah, it is.
What's the most common like skin thing that you try and heal with the Chinese herbs?
I would say acne is probably the most common, and
Oh,
then eczema.
okay. So what would you do if someone had eczema?
So I would have to ask them a whole bunch of questions. They would come in, we would sit and spend about an hour talking about how it looks, what it does, if there's any patterns. And then I come up with a formula for them. So it's a custom formula. And then they order it from me online. And then they take herbs for 3 to 6 months usually.
That's really cool. That's awesome.
It is.
All right. The next question is, what skills are beneficial to excel in your career?
I think being analytical actually is really helpful, because to come up with a diagnosis, you sort of have to follow like a particular train of thought, and you have to, while you're thinking, you have to analyze and determine which direction you're going to go to find your proper diagnosis. And then I also think that empathy is really important.
Yes, I think empathy is very important in all healthcare fields.
Absolutely.
All right, the next one is, what education did you need to complete before you became?
I think when I was in school, I think people needed like an associate's degree. I can't remember exactly, but I had a bachelor's degree. And then I did the acupuncture and oriental medicine master's at Northwestern.
Oh, you went to Northwestern. That's
Yeah,
awesome.
yeah, yeah. I've been in practice 14 years, so it's been a while since I was there.
So I didn't know that. Cool. What's something most people don't know about your profession?
I think people don't always realize how much schooling we have to do to become an acupuncturist. People think it's like a 6-month program. And then I tell them it's well, when I was in school, it's 3 years. And usually people are really surprised by that.
Okay. Yeah, I guess I didn't know how long it was either. So,
Yeah.
cool. What do you wish other professions knew about your profession to integrate better?
I wish they knew how many different things we can treat, because we kind of get stuck treating pain for referrals. A lot of times it's pain. Some of the doctors are really good at referring for fertility, but I never get, or very rarely get, a physician that is sending someone to an acupuncturist for dermatology. So I wish they knew that we could treat a lot of things.
So, you just said fertility. What would you do if someone came for you for advice on that?
Well, it kind of depends on what they're presenting with. So to treat fertility with Chinese medicine, you have to come up with a diagnosis,
Mhm.
and it can be one of 20 different things. So it's a lot of asking questions and then coming up with diagnosis. And a lot of times I use Chinese herbs for that too.
Okay.
Yeah.
What's the best way to get a referral?
From a doctor, that's difficult in private practice, getting a direct referral from a physician is challenging, unless you've really networked and like got your have your referral circle, so to speak. If you're working in a clinic or a hospital, it's a lot easier. um I've had people come to see me and said their doctor said to go get acupuncture, but they didn't say to come to me directly. But it's still, I mean, that's still a referral to some extent.
Mhm. Okay. Um, is there anything that you would like anyone to know about or have any questions for me that would be helpful
um
for people to know?
it doesn't hurt that much.
No?
No, it really doesn't hurt at all, and most people really really like acupuncture.
Yeah, I've never had that, so it would be very interesting to me.
Yeah, I would take advantage of it if you're not afraid of it.
Yeah, I would definitely like to. I'm living in Fargo right now because our meetings
Oh,
are online.
oh yeah, okay,
So when
sure.
I get down there, I'm definitely gonna try and take advantage of the student discount and stuff.
Yes, absolutely, it's worth it.
Do you have any advice for any students going into healthcare in general or acupuncture in specific?
um Maintain your personal and energetic boundaries.
All right.
Because that can be challenging when you're working with other people, especially if they're sick.
Yes, most definitely. Well,
Yeah.
thank you so much. That was so informational. Taking the time out of your busy schedule. I'm sure that was so nice of you. If you like a copy of the interview, I can send it to you in your email.
That's
Otherwise,
okay. I don't want to have to watch myself again.
all right. Sounds good. That was very short and brief, but again, I want to thank you so much. It was nice meeting you.
Yeah, absolutely. Good luck with everything.
Thank you so much.
Okay, take care.
You as well.
Bye-bye.
Bye.
Before we begin with Ayurvedic medicine, I just want to let you all know that the previous slide contains a fantastic interview with a Chinese medicine practitioner. Unfortunately, I won't be sharing it with you today, but if you have time, I highly recommend going back and watching it, as it gives great insight on the day-to-day life for a Chinese medicine practitioner. But moving on for Ayurvedic medicine, the paradigm of healing is the science of life. This incorporates different elements of the earth, fire, water, earth, space, and air into different doshas which help us understand our physiology. In terms of education, one can get a variety of degrees from the Minnesota Institute of Ayurveda. You can become a health counselor, a health practitioner, or also a doctor, depending on which degree you like. The environment is very integrative. They're normally found in integrative care, spas, holistic centers, or herbal retailers, as they have a variety of knowledge in all those different areas. The scope of practice is managing and treating disease from the Ayurvedic perspective. This can involve a variety of things where doctors may use purification or rejuvenation therapies, or also utilize Western pathology and also different treatments to supplement that Ayurvedic approach. They do not prescribe Western medicines, but they do use their own herbology and other items like that. There's a wide variation for income. It can range from $50,000 to $150,000, all depending what kind of education you get in this field. Area of focus is going to be a very holistic approach. They like looking at 5 different elements and try to utilize that for each special case. If you're looking to find an Ayurvedic health counselor or anything like that, there's a direct access as anyone is able to go to them. The next healthcare profession that we'll look at is medical assistants. In order to become one, you must first have a high school diploma, and then there's 2 different types of ways to get it. There is a certification program, or you can also get your associate's degree. Once you get your degree, you can go into mainly physician offices or also specialty offices. These specialties include chiropractic care, ophthalmology, podiatry, and OBGYN. The scope of practice comes with scheduling appointments, managing medical records, patient intake, assisting the provider with procedures, doing things such as drawing blood, administering medication, and other actions that can be performed during a procedure. The income is roughly an average of $35,720, but they can make up to $48,000. The last profession that I want to talk about today is musical therapists. You can become a music therapist by getting an MTBC, which is a certification, your bachelor's degree, your master's degree, or you can even get a doctorate in musical therapy. An environment that you work in is honestly everywhere. You can work in a clinic, you can be self-employed, the NICU, nursing homes, hospice, anywhere where someone is in need of a healthcare professional, you can work. Their scope of practice is collaborating with other health professionals to figure out what is the best way that I can help the patient. They do different assessments, trying to see what level of music knowledge the patient has. They also evaluate the responsiveness that the patient has to the treatment, and they try to minimize the barriers in order to make as much progress through the treatment. An average income for a musical therapist is $48,220, but it can range from $30,000 to $77,000 depending on your education. Lastly, I'd just like to show you our list of references. My group and I would like to thank you all for watching our presentation today, and I hope you all have a wonderful rest of your day. Thank you.